the Catalans, the Basques, the Galicians in the Basque.
An independent future for Scotland.
How quickly do you think a referendum can be arranged?
Best practice demands that it should be 6 months.
Just looking at the overall share numbers for Scotland at the moment, the SNP 46.4%.
Good afternoon. We are going to begin today with First Minister's questions, but before turning to the questions themselves, I'm going to ask the First Minister if she wishes to update us with a short statement on COVID. Thank you.
Thank you. I will give a short update on today's figures. 1,656 positive cases were reported yesterday, which is 7.5% of all tests carried out. The total number of cases, therefore, is now 166,583. As of yesterday, 309,909 people had received their first dose of vaccine. There are currently 2,003 people in hospital, which is 14 more than yesterday, and 156 people in intensive care, which is 6 more than yesterday. I very much regret to report that in the past 24 hours, a further 92 deaths were registered of patients who first tested positive over the previous 28 days, and the total number of people who have died under that daily measurement is 5,468. National Records of Scotland has also just published its weekly update that, of course, includes cases where COVID is a suspected or contributory cause of death, even if it hasn't been confirmed through a test. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID under the wider definition was 7,448. 368 of those deaths were registered in the most recent week, which is 23 fewer than in the week before that. 240 of last week's deaths took place in hospital, 97 in care homes, 4 in a different institutional setting, and 27 occurred at home or in another non-institutional setting. Of course, every one of these deaths is a source of heartbreak to loved ones, and so again, I send my condolences to everybody who is grieving. The figures that I've reported today demonstrate the seriousness of the situation we continue to face. As a result of the lockdown restrictions, as I reported to Parliament yesterday, case numbers appear to have stabilised, and indeed they may even be declining, but as we see again today, they remain too high. Hospital admissions are 30% higher now than at the peak of the first wave last April, and while admissions to intensive care are below the first wave peak, they have almost doubled since the turn of the year. All of this means that our NHS is under severe pressure, and given the number of new cases over the past couple of weeks, that pressure is almost certain to increase. It's therefore vital that we do everything we can to protect our NHS by slowing the spread of the virus and bringing case numbers down. That's why we confirmed yesterday that lockdown restrictions will remain in place until at least the middle of February, and of course it's why it's so important that all of us continue to comply with them. Put simply, that means we need to stay home. We should only leave home for essential purposes, such as caring, responsibilities, essential shopping, work that can't be done from home and essential exercise. We should not have people from other households in our houses, and we should not go into theirs. We should all work from home if we possibly can, and on any occasion when we are required to leave home, we should remember facts. Face coverings when doing essential shopping or out for other reasons. Avoid places that are busy. Clean hands and surfaces. Use 2-metre distancing if you're with someone from another household, and self-isolate and get tested if you have symptoms. Fundamentally, though, the best means of keeping ourselves safe right now is to stay at home as much as possible. So please stay at home, protect the NHS and save lives.
Thank you very much. Now, the First Minister will take questions. I would encourage all members who wish to ask a supplementary question to press their request to speak buttons, and I call on Ruth Davidson.
Thank you, Presiding Officer. Yesterday, the First Minister was asked a series of serious questions about why hundreds of thousands of doses of vaccine were not reaching GPs quickly enough. The questions asked were based on the evidence, the testimony of GPs, the testimony of the GP chair of BMA Scotland, the testimony of Scots over 80s who've heard nothing about when they will be called. In response, we got a bizarre rant that the UK government was throwing a so-called hissy fit about the publication of sensitive future vaccine supply figures. It was quite the change in tone from the Health Secretary's profuse apology on Friday. The First Minister got what she wanted, which was a cheap headline, but the country didn't get what it needed. The country didn't get what it needed, which was answers. So instead of trying to throw blame onto others, will the First Minister finally explain to the country why the vaccine rollout is lagging behind in Scotland? Why are hundreds of thousands of vaccine doses not reaching GPs and patients quickly enough?
First Minister.
I'll take each of these points in turn because all of them are important. Let me first of all say the vaccination programme is not lagging behind in Scotland. I set out yesterday that we had very deliberately focused first on elderly residents in care homes. Why did we do that? Because these are the people, according to the JCVI, who are most vulnerable to becoming ill and dying from COVID. So we have now vaccinated with the first dose more than 90% of those elderly residents of care homes. And that is what we think will have the biggest and most immediate impact in reducing the death toll from this virus, which, as we heard from the figures I reported today, is still far too high. And the reason why the overall numbers, therefore, are lower at this stage because of that focus in care homes is because it takes longer and is more labour-intensive to vaccinate in care homes than it is in the community. Interestingly, I've seen some comments this morning attributed to the UK government explaining why the daily rate of vaccination in England has dropped over the past 3 days, and the explanation given is that they have decided to focus more this week on catching up in care homes, and it takes longer. Therefore, the wider programme has slowed down as a result. So we are all grappling with the same issues, and we are all working to the same targets. Second point is GP supply, and I look, as the Health Secretary does, at these numbers every single day. I go to sleep at night with these numbers in my head. I wake up in the morning with them in my head, as is right and proper. AstraZeneca, and I'm talking about AstraZeneca here because that's the vaccine that is being used by our GPs. The vaccine comes in packs, normally packs of 100 doses, sometimes I understand perhaps of 80 doses. The supply, the shipment into Scotland has not, until recently, delivered enough packs for all GPs to have a pack of vaccine, remembering, of course, that some GPs will require multiple packs because their patient populations are bigger. Right now, and this figure will be moving all of the time, 75% of GP practices either have supply or are in the process of getting supply. That figure will never be 100% because not every single GP practice, of course, is participating in doing vaccinations. In terms of the over 80s, that is now picking up. And as I said yesterday, we reckon now, these are estimates from management information, this information will be published on a weekly basis, but we estimate that now around 20% of over 80s have been vaccinated. And my final point, Presiding Officer, because these are important issues, you can see from our daily figures that our community vaccination, the vaccination programme overall is ramping up. So if you look at the numbers of vaccines administered on Monday this week, 19,600, that is an increase of 56% on the previous Monday. Interestingly, since comparisons are being made by others, not by me, the increase in England from one Monday to the next was less than 40%. So our rate of increase is actually higher there as we come out of care homes and go into the community. And of course, yesterday, based on the figures I have just reported, 25,327 vaccinations were administered, which is more than Monday. So we are on an increasing trajectory of vaccination as we step up and pick up the pace in the over 80s. And of course, we are working to a target of vaccinating all over 80s and everybody in the JCVI groups 1 and 2 by the first week in February. So these are the targets we're all working to. I see commentary in the media elsewhere in the UK criticising the pace in England. These, if we look at this on a daily basis, we will always find questions to raise, and that's right and proper. But the progress of the vaccination programme is strong. My job, the Health Secretary's job, is to ensure that it remains so.
Ruth Davidson.
Thank you, Presiding Officer. Prioritising care homes, as the Scottish Conservatives have always argued we should, doesn't explain why GP surgeries who should have doses of vaccine sitting in their fridges don't. The problem here is this insistence from the First Minister that this is all on track. But Health Secretary Jean Freeman said on the 11th of January that all over 80s would have the vaccine by the end of this month, which is the 31st of January. But this morning, the Deputy First Minister, John Swinney, rolled back on that commitment, saying instead that I can confidently say to you that the commitments we have given, that the over 80s, for example, will all be vaccinated by the end of the first week of February, is a commitment that will be fulfilled. Repeated just now by the First Minister. So the Health Secretary's committed to all over 80s being vaccinated by the 31st of January, but the Deputy First Minister has committed to the 7th of February. The First Minister called this vaccination programme a race against COVID, and I agree with her sense of urgency. So why are we already falling behind?
First Minister.
Well, there's 3 points here, and I'll again take them one by one, because Ruth Davidson is just wrong on all of them, actually. Firstly, on care homes, it is the case that we have been focusing on care homes, rightly so, because that is the quickest way to reduce the death toll, because people in care homes are most vulnerable. And how many times over the past year, rightly, have I stood here and been under pressure to answer questions about the death toll and the wider toll of this virus in our care homes. So it's right that we have prioritised care homes. Indeed, it is what the JCVI recommended, and it does take longer. This is what I've seen it being reported that the UK government has been saying today to explain the dip in the English vaccination rate, daily vaccination rate over the past few days. The explanation: there has been a big push to finish vaccinating care homes, and they take more time, 4 to 6 hours each, hence slowing the overall effort. So, it is the case that when you focus in care homes, you don't do as many because it takes longer. But we, unlike the UK government, who, I don't know what their figure is now, at the start of the week, I think it was only 50% of care home residents vaccinated. We're now over 90% and therefore able to speed up the rest of the programme. Secondly, on the timing of over 80s, I mean, Ruth Davidson can go back, and I think the first time, certainly in this year, I spoke about this was last week in one of my daily updates, and I said that we would do over 80s within 4 weeks, which was always that first week in February. That is not a change. I said it in Parliament again yesterday, the start of February. That is the target date for vaccinating all of the JCVI groups 1 and 2. And then, of course, we do the groups 3 and 4, and the target date for that is mid-February. Again, I've seen comments from the UK government this morning talking about the rephasing of Pfizer supply, making that a very tight target to meet, but one that we're all determined to do. And lastly, just to repeat, because it possibly didn't get heard by Ruth Davidson the first time I said it, on GP supply, I've set out the supply constraints we've had so far in terms of getting packs of vaccine to every GP practice. That is speeding up as supply speeds up, and The figure, which again will be moving all the time, will no doubt be different by the end of today than it is right now. 75% of GP practices already have or are in the process of receiving their supply. But again, the figures speak for themselves. From Monday last week to Monday this week, a 56% increase in daily vaccination. From Monday to Tuesday, yesterday, a further increase in the rate of vaccination. So the numbers at the moment speak for themselves. They're going in the right direction. My job is to make sure they continue to do so.
Ruth Davidson.
But the Health Minister said the end of January, and you cannot get away from that. Now, the First Minister has just said, before she sat down there, that the figures speak for themselves. And she's right, because the numbers here are pretty straightforward. As the Deputy First Minister has now accepted, the Scottish Government is in receipt of a total of 700,000 doses. But to vaccinate the first of the priority groups, which is care home residents, staff, healthcare workers and everybody over the age of 80, the Scottish Government, by their own figures, need 560,000 vaccine doses. Again, by their own figures released on the 11th of January, the Scottish Government already had 490,000 doses sitting ready to go a fortnight ago. So the Scottish Government was already sitting on enough stocks to vaccinate 87.5% of their target groups and have been for a fortnight. Today, we hear that 309,909 have actually received the vaccine, which is 55%. And now the delivery date has slipped by a week. Why? Can the First Minister confirm that the stocks from even 2 weeks ago have reached GPs?
First Minister.
OK, we'll go through this point by point again, because they're all important points. But again, Ruth Davidson's wrong, and I'm going to take her on a bit of a logic journey on this as well, which may not take her where she wants to go. But firstly, there is a difference, and those of us who pore over this on a daily basis have to understand these differences between allocation and actual delivery and what we have in hand in Scotland. And the majority of doses that are in Scotland are actually already in people's arms, and the rest of them will be supplying GPs and other vaccination centres to make sure over the next few days they get into people's arms. That is how a supply chain of anything works. But here's the logic journey. If Ruth Davidson's whole argument here is based on the premise that we've somehow got 700,000 doses, and remember the UK Government are adamant they don't want us to talk about the total number of doses that have been allocated, but let's take what she's saying. If that is the case, then that must mean that, given that we're getting our proportionate population-based share, the UK Government for England have got 7 million doses. They haven't done 7 million vaccinations, so presumably they're also sitting on supplies for no reason, in the same way that Ruth Davidson is suggesting we are. That would be the logical conclusion of that argument. It's actually about a complex, really important, but a complex supply chain that everybody is working to make sure gets from the manufacturers to the arms of people across the country as quickly as possible. And we've been successful in making sure that almost all of our most vulnerable care home residents have already got that first dose of vaccine. And finally, on this point about end of January versus the beginning of February, we refine these target dates as we go along based on our developing understanding of supply. So if the Health Secretary did, and I can't recall, but if she did say a few weeks ago the end of January, we will now know more about supply that have made us, through the modelling we do, say that that's the first few days in February. We've been saying that consistently throughout this year. So there is no change in that. That is what we are working to. That is what we are on track to deliver. And I would suggest that Ruth Davidson perhaps just delves a little bit more into the detail of how all of this works if she wants to continue to have these exchanges.
Ruth Davidson.
There we have it, Presiding Officer. It's not a slip, it's a refinement. But the problems here have been building for some time, and the Scottish Government continues to stand by and furiously repeat that everything is fine. But GPs and the BMA are sounding the alarm, and they are raising the red flags, not to be awkward, but because they and us and everyone wants this vaccination programme to work, and time is of the essence. And it is important that the First Minister acknowledges problems and starts to fix them. There are hundreds of thousands of vaccine doses that have gone unused for weeks, while GPs are desperate to get their hands on it. We asked last week when all over 80s would get their letter notifying them when they would be vaccinated, and we got no answer. We asked yesterday when all GPs would have the supplies they need to accelerate the pace, and we got no answer. And I have just asked if even all available stocks from a fortnight ago have been distributed to GPs, and I've got no answer. And the simple fact is, this isn't good enough. Vaccine isn't getting to GPs as it should. Over 80s are being left waiting when they shouldn't have to, and government timescales are already slipping. Sorry, being refined. What action is the First Minister going to take to get this sorted out and get Scotland's vaccination rate back on track?
First Minister.
Can I say, if Ruth Davidson, in a programme like this, doesn't think it is really important and responsible for governments to refine estimates as knowledge of supplies increases, then I think it will just be another reason why many people across the country are breathing a real sigh of relief that she's not standing here right now. One of the things that has changed, and if Ruth Davidson's not aware of this, it's on the front page of the UK Times today, with the UK government talking about it. Pfizer has just rephased its supply over the next few months. So over this month and next month, we are going to have fewer doses of Pfizer. We'll have the same overall, but the phasing of that is different. Now, is Ruth Davidson seriously suggesting that in the face of a change like that, a government shouldn't refine its estimates for when it will be able to deliver vaccine into people's arms? Because if she is suggesting that, then I think that is ludicrous, to be perfectly honest about it. Now, let me just answer some of the other points. Letters to over 80s. Many GP practices are not sending letters to over 80s. Do you know why? Because they are phoning them because it's quicker, so that as soon as they have the supplies, they are phoning them to make the quickest appointment that they can. That happened last week to a very close relative of mine in the over 80 category. Got a phone call from a GP practice and within a couple of days had her first dose of the vaccine. That is how this has been done, to make sure it is as quickly as possible. So as the supplies come in, and I've set out twice just now what the supply constraint has been in getting packs to every GP practice, but I'll repeat again, 75% of GPs have or are in the process of getting that supply, and as soon as they get it, they contact their over 80s to get them in. But I come back to the central numbers here. Our vaccination programme is gathering pace. 50% increase in the daily numbers of people vaccinated from last Monday to this Monday, a further increase from Monday to Tuesday this week. Having done more than 90% of care home residents, we're picking up pace now in the over 80s. These are the facts in a very, very complex situation, and I will continue on a daily basis to focus on the detail and actually focus on understanding the detail of this so that we do get it right, not just for the over 80s, but for the over 70s, the over 50s, and as soon as supplies allow us to, for the whole adult population.
Thank you. Jackie Baillie.
Thank you, Presiding Officer. There is nothing more important currently than the rollout of the vaccine. We need to fight this virus, and every drop of the vaccine should find its way into people's arms. Last week, the government published the COVID-19 deployment plan, which allowed for 5% of COVID vaccines to be wasted. So can I ask the First Minister, can she tell us how many doses of vaccine have been wasted since rollout began?
First Minister.
I think from memory, I set this out in some detail again yesterday. So we make, and not just the Scottish Government, as I understand it, as I've been told by clinical advisors to ours, this is a sort of international standard around wastage assumptions in a programme of this scale. 5% is a planning assumption. What it is there to do is just to make sure we're factoring in the possibility that we hope never happens of some large-scale breakdown in the supply chain. You know, a big freezer might malfunction or something else happens that disrupts a significant portion of supply. So it's just to make sure that we've got that cushion should that happen, so that if that was to happen, we're still able to vaccinate the numbers of people that we are estimating. There is not 5% wastage in practice. I think I said this yesterday. So far, and this again will be a figure that fluctuates, the wastage rate is around 1%. Now, there are huge efforts to get that even lower, but in any vaccination programme, and people will understand this, human error, people will drop vials and they'll break, or they'll make an error when they're opening them, putting the vaccine into a syringe, or somebody will have got a syringe ready for somebody that then either doesn't turn up for the vaccine or turns up and for some reason they can't be vaccinated. That is just unavoidable to some extent, but the effort is to minimise it. But the 5% is a planning assumption, which I think is sensible, given the things that could go wrong in a programme of this size, but all of us hope never do.
Thank you, Baillie.
I entirely accept the need for planning assumptions when you're planning a vaccination programme, and I welcome the fact that the programme is doing better than the worst case scenario. But, presiding officer, wastage at the weekend was at 1.82%. Let me put that in real terms. That's something like 5,000 doses since the rollout began, when people desperately need this vaccine. Are we to believe that this is all burst vials and spillages? On Sunday, the Chief Executive of NHS England, Simon Stevens, said this in response to questions about how surplus vaccine should be used. The guidance from the Chief Medical Officer and from the NHS is if at the end of your vaccination session you've got a few doses left over, then please have a reserved list of staff and high-risk patients. When Professor Jason Leach was asked about wastage at the COVID committee last week, he was only able to provide an example of what would happen to unused vaccines in a hospital setting. So can I ask the First Minister, has guidance been supplied to GP surgeries and mass vaccination centres to ensure that they have a reserve list of high-risk patients to avoid wasting the vaccine?
First Minister.
There's guidance published on a whole range of things. I will specifically check the state of the guidance on these particular points, and we will circulate that. And if there are areas where we need to have more guidance, we will do that. It's in nobody's interest to have doses of this vaccine wasted. But let me give an example, which actually was subject to some criticism yesterday for how a health board was avoiding wasting doses. The Scottish Ambulance Service got doses to vaccinate their frontline paramedics and ambulance technicians. They had some doses left, so they decided to use them for call handlers, non-patient facing. That was subject to some criticism because it's frontline patient facing health workers that are in the front line and have highest priorities. Their argument is that that was a pragmatic decision to avoid wasting vaccines. So these decisions are being taken by frontline people all of the time. And often what you find, as was the case with that, is it then gets criticised because it appears to be out with the strict order of priority. It's in nobody's interest to waste vials or doses of vaccines, and unless somebody is telling me that there's some dastardly secret, unknown and for whatever motivation attempts on the front line here not to use every possible dose of vaccine, then I am confident that because people doing the vaccination programme are experienced. Many of them deliver the flu vaccination programme every single year. The others, and again, the training programme has been criticised, but part of that is so that people who perhaps don't have experience or recent experience of doing vaccinations know what to do in all of these situations. So often it's the things we do to try to address some of these issues that end up on another day in this chamber being subject to criticism from the same people that are raising these issues right now.
Jackie Baillie.
Thank you very much, Presiding Officer. I am all in favour of pragmatism, which is why I asked about guidance, and I hope the First Minister will check that. Because we know that doctors, vaccinators, cannot work in the dark on these issues, and we cannot risk any doses being thrown away because the guidance from government is either slow or unclear. So I welcome the assurance from the First Minister that she will check about guidance for vaccinators, because the First Minister knows the logistical challenges with the Pfizer vaccine and the greater chance of doses being unused. There have been some reports in some health boards that vaccines have been binned because of the change of policy on second doses. So can the First Minister assure the Chamber that any unused vaccines that cannot be used for the priority groups can be provided as second doses for healthcare professionals, something called for by the BMA? And finally, transparency is vital here, Presiding Officer. So can the First Minister commit to publishing weekly statistics on wastage so that every drop of vaccine goes to saving lives?
First Minister.
We're already publishing we publish daily statistics on the numbers of vaccines administered. We are publishing weekly statistics that are have more detail. I've given a commitment before. We will add detail to that as we go along. There is always a balance to be struck between tying people up in gathering data and reporting data on the one hand, and actually doing the job that they're there to do, get vaccine into people's arms on the other hand. But we will be open and transparent about all of that in as much detail as we possibly can. Doses of the vaccine will be used to vaccinate people. That is a focus right now on the first dose of the vaccine to as many people as quickly as possible, and then the second doses will come from that. The family member I referred to earlier on, when she went for her first dose last week, she was given the date for her second dose. So already that is in the planning, and that is part of the planning as well around the use and the flow of doses, particularly if there is going to be a rephasing of as there is a rephasing of the Pfizer vaccine. Already the people who model this for us are having to make sure that we will have enough Pfizer vaccine come the time of those second doses to do that. So that's just one other reason why this is a complex exercise, but it's important we get it right. And in terms of doctors or those who carry out vaccinations on the front line, many of them will be highly experienced at doing vaccination and know the issues that they've got to be aware of, but also that's what the training is for. I've faced questions in recent days, why is the training so bureaucratic? Well, there have been efforts to simplify the training as far as possible, but the reason why the training is important is to make sure that people, particularly those who don't have recent or any experience of carrying out vaccinations, know exactly what they should do in these circumstances. So, I think given the scale of this, given the complexity of this and given the importance of this, I think the vaccination programme is going well. I don't say that with an iota of complacency, because I understand the vital importance of getting this vaccination to as many people, to the whole adult population, as quickly as possible. That's why it has a daily focus from me, from the Health Secretary, from the Government as a whole, and we will continue to ensure that is the case.
Thank you. Question number 3, Patrick Harvie, who joins us remotely.
Thank you, Presiding Officer. It is good news that people in Scotland are showing strong support for vaccination, but we do still need to take action to get as high a take-up as possible. Scottish Care, for example, have warned that the majority of care homes in Scotland had been approached by anti-vaccination groups, and SAGE have advised that vaccine hesitancy may be particularly high among Black, Asian and minority ethnic communities. Can the First Minister tell us what the Government is doing to prevent the spread of misinformation and conspiracy theories, and specifically what action being taken to support vaccine take-up in marginalised communities?
First Minister.
We, through a range of different means, will take on myths and smears and misinformation about vaccine. We will do that through our advertising and marketing campaigns. Will do that in very specific ways. So care homes, for example, the Chief Medical Officer, the Chief Nursing Officer, the National Clinical Director and the Chief Pharmaceutical Officer are writing directly to care home managers to provide information that they can then disseminate amongst their workforces. There will be webinars with care home workers to make sure legitimate questions can be answered and addressed, but any myths and misinformation can be dealt with as well. And we shouldn't be complacent about this in any group in society, but if we take care home workers just as a group, because that's where the initial concerns have been expressed in just recent days. But we see there, and as I reported yesterday, more than 70% of care home workers have already been vaccinated with the first dose, which suggests there is strong take-up and strong enthusiasm for being vaccinated. But we need to get the uptake of this programme as high as possible to provide as much protection as possible. So we will have to work on an ongoing basis to take on anything that is threatening to hamper that. That's particularly important in some other groups, in ethnic minority populations, for example, in more deprived communities, and we will take forward that work as well. But of course, the focus right now is to make sure these clinical priority groups, wherever people in these groups live, whatever backgrounds they're from, are reached with this vaccine, and that is the work that is ongoing right across the country right now.
Patrick Harvie.
I think government, opposition parties and also the media have a shared responsibility to avoid the kind of complacency that the First Minister mentions. Of course, one of the biggest proponents globally of dangerous misinformation, from COVID to climate and more, has been kicked off Twitter and Facebook, today is being kicked out of the White House, and it's time we kicked his toxic brand out of Scotland too. From today, Donald Trump will no longer be the US president, and his business activities are under criminal investigation in the US. But his purchases in Scotland have still not been investigated, in spite of serious concerns about how they were funded. The Greens have long called for these dodgy deals to be investigated using an unexplained wealth order. Whenever we raise this, the First Minister has told us that it's not her decision to make. Has she seen the legal advice from a senior QC published this week by the campaign group Avaz, making it crystal clear that this power lies with her and her cabinet? Will the First Minister stop hiding behind officials and seek an unexplained wealth order to ensure that Trump's purchases in Scotland are given the scrutiny they urgently need?
First Minister.
Well, firstly, I'm sure many of us across the Chamber and across Scotland will be very happy to say cheerio to Donald Trump today. I think "don't haste you back" might be the perfect rejoinder to him. And in advance of the inauguration later on, I'm sure we all want to send our congratulations to soon-to-be President Biden and soon-to-be Vice President Kamala Harris. Kamala Harris in particular today doesn't just become the Vice President, she makes history in a number of different ways, and she has my warm congratulations on that. On the issue about legal, I've seen reports of the legal advice Patrick Harvie refers to. I've not read it in detail. I'm happy to do so and come back to him in more detail. Of course, the government has its own sources of legal advice, and what I've set out before is how investigation and decisions around unexplained wealth orders are taken. These are matters that lie with the Lord Advocate, but I'm happy to look in more detail at any information that is put to me, and if there are further points I think it is appropriate to make, I will do so.
Thank you. Question 4, Willie Rennie.
The First Minister opposed testing of students until there were big outbreaks in universities. She criticised the use of lateral flow tests in Liverpool, claiming they were politically motivated. Then, well after the start of the second wave, she changed her mind. She refused to implement airport testing until months after holidaymakers brought the virus back from abroad. And now she's got the capacity of the PCR tests, but refuses to use most of them. On testing, why does this government always shut the stable door after the horse has bolted?
First Minister.
Sometimes when Willie Rennie's scripting these questions, if it never crosses his mind, what is my possible motivation for just opposing all these things, that if I really thought they could help us beat this virus and save lives, why on earth would I oppose them? Actually, what we do in the Scottish Government, we don't always get it right. I'd be the last to say we do. We make mistakes. We have made mistakes in the course of this. We've tried to learn as we go. But we try to understand the technology, the use of the technology, the pros and cons, and make informed decisions. And why today of all days do I think it is important on testing to make that point is that, you know, south of the border, not that long ago, before Christmas, there was a big announcement made about the rollout of lateral flow testing in schools to every pupil daily. Lateral flow testing. It's been paused today because it is not practical and it is not sensible to do it in that way. So we try to make sure that we get these things as right as we possibly can. The lateral flow technology, we haven't had lateral flow tests in volumes or indeed at all until relatively recently in the pandemic. And there is still mixed opinion, which is part of the reason the MHRA hasn't given the go-ahead to what was wanted in England in schools about just where and how effective they are to use. I think they are an addition to what we've done through PCR, but we need to continue to consider these things really, really carefully. And, you know, the last point I'd make about this, and I hope people would agree, I'm one of the last people that ever stands here and is complacent in any way about the challenge we face right now. We are in a precarious, difficult position. People are living under horrendous restrictions. So the situation in Scotland is not good. But if we are doing everything as wrong as Willie Rennie keeps trying to suggest, then why is it that, albeit we're in a very difficult position, actually case rates have been almost throughout this pandemic and remain so much lower than they are in the other UK nations and in many other parts of Europe. So we've got lots still to do, lots still to learn. Of course we make mistakes, but sometimes maybe people want to reflect on the fact we don't always get everything wrong.
Willie Rennie.
God forbid that we ever ask questions of this First Minister when we think she gets it wrong. I mean, the reason why I question her is because the evidence is clear that the First Minister is always behind the curve on the testing. I just read out the list of reasons that she initially opposed and then she supported it only weeks later, but only after there were big outbreaks. And that's when we needed the tests, before the outbreaks. Last week, for example, I proposed deploying that PCR testing capacity at supermarkets, Royal Mail sorting offices and police stations should be rolled out. The front line. Once again, the First Minister said no. As a result, 50,000 tests go unused every single day. Now, since Christmas, the SNP government have failed to use nearly 1 million of those gold standard PCR tests. That's the phrase they use, gold standard. Now, to be precise, that's 908,585 potential tests wasted. First Minister says she is saving them for a rainy day. Well, First Minister, it's bucketing down outside if she hasn't noticed. We have no idea when schools are going to reopen. Operations in hospitals are being cancelled. Businesses are on their knees and we have been told not to leave our homes. So how bad does it have to get before we get this SNP government to use those tests to detect the virus hiding in our communities?
First Minister.
Can we clear one thing up at the outset, Presiding Officer? Just because I disagree with Willie Rennie, just because I think he's downright wrong and doesn't necessarily always understand the issues that he's asking me about, just because I take issue with the fact that he puts words in my mouth that I've never ever used, does not mean I don't like or accept getting asked questions. I've probably answered more questions in the course of this pandemic than any leader anywhere else in the world. And along the way, I've probably admitted to more mistakes, not necessarily because we've made more mistakes, but because we've been upfront in conceding that we've made mistakes. So, Willie Rennie has to recognise that if he wants to, as he is absolutely right to do, ask these questions, sometimes if I don't think he's getting it right, I've got a right to say so as well. Now, on the issues, Willie Rennie says we've failed to use all of these PCR tests. These are PCR tests that are there for symptomatic people to get tested when they have symptoms. If you have symptoms, self-isolate and get tested. If we used all of these symptomatic tests, we'd have a prevalence and incident rate right now that was multiple times higher than it is. And that would not be a good thing. That would be a really, really bad thing and a terrible position to be in. And on the more widespread use of testing, we evaluate, we take advice, we look at where we can use testing strategically and tactically. And I don't know, maybe Willie Rennie would have preferred us to stand up before Christmas and say we're going to test every pupil in every school every day, and then have to stand here right now and say, actually, we can't do that because we got that wrong. We've decided to do it in a different way so that when we do launch these testing programmes, we try to get them right and we make sure they contribute overall to having case levels lower than in many other countries, and hopefully over the next weeks getting case rates coming down firmly again.
Thank you. Question 5, John Mason.
Thank you. To ask the First Minister what her response is to the announcement that the UK Shared Prosperity Fund will be operated by the UK Government and not by the Scottish Government and the other devolved administrations.
First Minister.
Well, it's another direct assault on devolution, and I'm disappointed, though not surprised, that the UK Government has decided to take this approach. It definitely raises grave concerns and uncertainty for communities, which of course are compounded by a lack of detail on the future shape of these funds. Funding of this nature should be decided in this Parliament with all the democratic accountability for that, not by remote Whitehall departments with little understanding of the needs of communities concerned. So I encourage the UK Government to reconsider its position.
John Mason.
I thank the First Minister for that answer. It does appear that Westminster is seeking to undermine all three devolved governments. And the fear is that money will be spent on their political ends and not based on need. Does the First Minister trust Westminster?
First Minister.
Let me think about that. On balance, after careful consideration, no, I don't, generally speaking, trust Westminster. Look, this is a serious issue, and it is, unfortunately, I think, illustrative of a more general approach by the UK Government to undermine this Parliament, to undermine devolution and to grab powers and resources away from this Parliament. And whatever our differences across this chamber, I really would have hoped that all of us could unite to say no to that kind of approach, and maybe we'll yet manage to do so. The UK Government has not consulted with or worked with Scottish ministers sufficiently on the development of the Shared Prosperity Fund, despite us developing clear proposals for a Scottish Shared Prosperity Fund. The UK Government kept us at arm's length throughout the process. They've provided no clarity on their objectives, on their delivery plans. They've provided no evidence as to why a clearly devolved policy should no longer be run or administered from Scotland. So it is vital that clarity is given urgently and that we receive our fair share of funding. As John Mason has highlighted, the losers here, ultimately, whatever the politics of this, whatever the political disagreements, the losers here stand to be Scottish communities, Scottish people, businesses and organisations. And I think it's more important that the needs and interests of those communities are put first, not undermined and politically, potentially harmed for political reasons.
Question 6, Brian Whittle.
Thank you, Presiding Officer. To ask the First Minister what action the Scottish Government is taking to make the training of vaccinators as streamlined as possible.
First Minister.
I think I may be about to prove a point that I made earlier in response to Jackie Baillie. Our approach to COVID vaccination training aligns, first of all, with that taken by Public Health England and has been informed by discussions with all of the UK nations. It takes proper account of the existing skills and experience of those being deployed. So for individuals who are experienced active vaccinators, training need only cover the specific characteristics of the COVID vaccines. Training requirements for individuals who might be returning to service after being inactive for a period are informed by a short self-assessment, so may take longer. That said, we recognise the need for a proportionate approach to any induction required over and above vaccination training. NHS Greater Glasgow and Clyde, for example, has already streamlined its processes by introducing pre-clinic huddles covering matters that may otherwise have formed part of induction training. And we have written to all NHS boards encouraging them to take similar steps.
Brian Whittle.
Can I thank the First Minister for that response. However, the Chair of the BMA Scotland GP Committee and the British Dental Association Scottish Committee have raised concerns about the process. It has been described as clunky, bureaucratic and containing training modules on subjects that seem to have little relevance to what vaccinators are being asked to do. Patient safety is, of course, paramount, but does the First Minister accept that unnecessary red tape and bureaucratic delays cannot be allowed to deter those applying to become vaccinators?
Yes, I do agree with that, and I think unnecessary bureaucracy, unnecessary red tape should always be removed. And as I said, Greater Glasgow and Clyde is a good example of a health board that's already done that. We're encouraging all health boards to do that. But it is really important that those putting vaccine into the arms of people across the country have appropriate training. And my exchange with Jackie Baillie made the point that some of the issues she was legitimately raising are some of the issues we need to ensure training for, so that we can avoid wastage in the programme and those doing the vaccinations know exactly what is required of them. So there is a tailored approach. Those who will do flu vaccination every year, so our active vaccinators will only need to be trained in the specific characteristics of COVID vaccination. Those who've got less experience or less recent experience need more training than that in order to ensure patient safety, but also to ensure that they know all of the do's and don'ts. So it's always a case of getting this balance right, but the approach being taken across the UK is very much aligned, and it's there for the right reasons.
Thank you. Question number 7, Rhoda Grant.
To ask the First Minister what action the Scottish Government is taking to ensure there is adequate protection for victims of domestic.
First Minister.
Well, I think we all agree, I know we all agree that it's completely unacceptable that for some people home is not the place of safety that it is for most of us. Right throughout the pandemic, we have urged anyone at risk of domestic abuse to reach out and get the support that they need. Lockdown restrictions, and it's really important to stress this, do not prevent someone leaving their home if they are escaping domestic abuse, and support services have remained open right throughout the pandemic. Police Scotland also continue to treat domestic abuse as a priority and will respond to all calls about domestic abuse. The Government has provided organisations organisations, including Scottish Women's Aid and Rape Crisis Scotland, with additional funding to allow them to increase capacity of their services and meet demand. And we've worked with the UK Government on a code word scheme in participating pharmacies to increase access routes to help in the community. And we will continue, of course, to take all appropriate steps to make sure that those who do need support get that support.
Rhoda Grant.
The First Minister must have been as distressed as I was reading in the Sunday Post about how badly Louise Aitchison was let down by the police both before and after her murder. She'll also be aware that the domestic abuse bill going through the Parliament at the moment is so poorly drafted that it's a real cause for concern. While taking evidence on the bill, the Justice Committee have been told that Police Scotland are not using all the powers now available to them to protect victims of domestic abuse. Can I ask what her government is doing to ensure that all existing protections are being used? And can she guarantee that ministers will work constructively with the Justice Committee to make sure that the current bill works? Because it's a national disgrace that anyone reaching out for help is being abandoned and murdered as a result.
First Minister.
The tragic situation that Rhoda Grant has referred to, of course, is deeply distressing. I think all of us would agree that it is deeply distressing when any victim of domestic abuse, for whatever reason, doesn't get the support they need in time to avoid tragic outcomes like that one. And all of us recognise that we need to continually seek to do more to make sure that everybody gets the help they need. First and foremost, that they feel they can reach out for the help they need, and of course that they then get that help. And that's why some of the actions I've spoken about already today are so important. In terms of the Domestic Abuse Protection Bill, which, as Rhoda Grant rightly says, is going through Parliament, that will provide police and courts with further powers to protect people at risk. I will very willingly pass Rhoda Grant's comments about the Police Scotland to the Chief Constable. He may want to respond directly, but I know from my conversations with the Chief Constable how seriously he and Police Scotland as an organisation take the responsibility they have to help those who are victims or potential victims of domestic abuse. And at every occasion when the Chief Constable has joined me in briefings around COVID, I think on every occasion he has taken the opportunity to stress to any victims of domestic abuse that the police are there for them 24/7 and that they should always call. But as long as any woman is losing their life or being a victim in any way of domestic abuse, or anybody is for that matter, although it is principally women, then we have more to do. And I think everybody across this Parliament, and I know I do, take that very seriously indeed.
Thank you. We've got a number of supplementaries. Christine Graham, to be followed by Maurice Corrie. Christine Graham.
Thank you very much, Presiding Officer. The First Minister referred in passing about the production of the Pfizer COVID vaccine possibly being delayed during this month and early February. Constituents have contacted me concerned that this may affect giving them their second dose within the 12-week, within the time when they've had their first dose. Could the First Minister perhaps clarify and comment?
First Minister.
Well, as I've said earlier on, and is a matter of public record, Pfizer have rephased their manufacturing, which will result not in the UK getting fewer Pfizer doses, but that being phased over a longer period. So that will result in fewer Pfizer doses being available to Scotland and other UK nations over the next couple of months. The teams who model our vaccine supply against our ability to deliver in these groups are looking carefully at this to make sure that we have properly factored in any impact on the second dose scheduling, and that is work that will continue to be done and refined as our understanding of supply gets clearer. And it may be, can't say this with any certainty right now, but it may be the case that at some point over the next few weeks, some doses of the Pfizer vaccine have to be held back in order to ensure that second doses can be done within the 12-week timescale. But that's why when Ruth Davidson mocked my reference to refining things earlier on, that's why we need to refine all of this literally on a daily basis as supply estimates become clearer, as they change, as they do change. not irregularly, so that we make sure that the flow of supply is matching the demand of people that we have to vaccinate. Right now, focus on first vaccination, but as we go through the next few weeks, that also means making sure that we've got the supplies to do second dose vaccinations as well.
Thank you, Maurice Corrie, to be followed by Sarah Boyack.
Presiding officer, and many of my constituents have been in touch with me expressing their concerns at the pace of the rollout of the coronavirus vaccine. Figures released last week showed both Greater Glasgow and Clyde and Highland Health Boards were below average in terms of first dose coverage. Yesterday, the First Minister said 70% of healthcare workers had received their first dose. Will she commit to publishing those staff figures at a health board level so that we can see and can better understand and track the progress of it?
First Minister.
I'm not going to repeat everything I said to make the point that we're not behind. We are progressing well and picking up pace in our vaccination programme. I've said previously we will continue to provide more detailed breakdowns on a weekly basis of the vaccination figures, both by cohort of JCVI priority group, but also geographically as well. We've had a request, a not unreasonable request today, to see if we can include figures on the numbers of doses wasted through unavoidable means. So we will look at all of that. There is no interest in any part of the government right now in not being transparent about this. This is a collective endeavour. This is important to all of us. It's important to me, first and foremost, as First Minister, to make sure we conduct this vaccination programme with the speed and efficiency that people expect. But, you know, as well as being First Minister, I know people across the chamber might struggle to accept this. I'm a human being with loved ones of my own. I want them to be vaccinated as quickly as possible. All of us want this programme to go well and to go as quickly as possible. Nothing right now is more important to me than making sure that happens.
Thank you. Sarah Boyack, to be followed by Willie Coffey.
First Minister, NUS Scotland published research last week which showed the shocking levels of debt that students experience, which have been made worse by the pandemic. What support will the Scottish Government offer now and going forward to help students who have lost their jobs and are falling further and further into debt, with a shocking 14% now having to use food banks to survive the pandemic?
First Minister.
These are serious issues. We've already provided additional funding to make more hardship funding available to students, and we will continue to discuss with the NUS, universities and others how we can provide more support. This is a really difficult situation for students. Like many young people, they've had their education disrupted. Everybody's suffering disruption right now, but students will also be affected because many of the jobs that they do to make money during term time are in sectors that are closed right now. So it's almost a double whammy for students. So we will continue to do as much as we can to help with that. Of course, this is not pandemic specific, but more generally, our position on not charging students tuition fees mean that levels of student debt in Scotland are much lower than they are in other UK nations, but the pressures of the pandemic, of course, are being felt very acutely, so there is a need for us to step up and do as much as we can.
Willie Coffey, to be followed by Beatrice Wishart.
Thank you. Can I ask the First Minister if there has been a drop-off in numbers of diagnoses of cancers and other major health issues during the COVID pandemic, and how the Scottish Government is encouraging people to come forward?
First Minister.
Well, from January to June last year, we did see a drop-off, for example, 19% fewer cancers being diagnosed compared to previous years. So that has been a concern throughout the pandemic. And of course, is why we launched the NHS's Open campaign, which people may recall seeing in different formats. And that is to remind people that they should continue to come forward for non-COVID health concerns. That's been followed by the Right Care, Right Place campaign. It started in December, which incorporates the national door drop that starts this week, providing information on the range of NHS services that are available, and includes a reminder for those, for example, with a persistent cough for more than 3 weeks, that could be a potential sign of lung cancer, so to contact their GP. And I would say to anyone listening, I know many people watch First Minister's Questions, daily briefings to get information on COVID, but I take the opportunity to say to anyone listening You hear me say, if you've got COVID symptoms, self-isolate and get tested. But it's a really, really important message to say to everybody, if you're experiencing any new signs or symptoms that are worrying you, changes in your weight, changes in your appetite, lumps that you're concerned about, whatever it might be, then contact your GP practice, because they are open and they want to hear from you. The chances are there'll be nothing seriously wrong with you, but early diagnosis of cancer in particular is absolutely crucial in improving the chance of a patient going on to live a long life. So please, the NHS is open and everybody should feel able to use it.
Beatrice Wishart, to be followed by Kenneth Gibson.
Thank you, Presiding Officer. People understand that the Scottish Government is following JCVI priority recommendations, but are worried about the potential for strict interpretation. A small number of my constituents need to travel to mainland hospitals for appointments, including weekly visits for life-saving cancer treatment, and that necessary travel can leave them more exposed. They are extremely vulnerable, but are not eligible for the vaccine, even though some of them are on the cusp. Can the First Minister assure my constituents that there will be room for clinicians to make common sense decisions on vaccinations in circumstances like these?
First Minister.
These are important points. I would make a couple of points in response as briefly as possible. The JCVI list is there because these are people who are deemed to be most vulnerable. I think we all understand that. I've got huge sympathy for everybody who makes a case for prioritisation above where the JCVI lists say they should be. While we still have limited supplies, though, every time if we were to agree greater prioritisation for one group, we would have to deprioritise another group. But within that general point, those with terminal illnesses, and I know this will be particularly acute in island communities, but people with terminal, I had a meeting last week with Fred Banning, a man who is terminally ill himself, who's campaigning for greater priority for the vaccine and doing a sterling job to make sure that the needs of those in his position are understood and not overlooked. And I've agreed that we will continue to engage on these matters with the JCVI. Many people who are terminally ill will be in what's called the clinically extremely vulnerable group. So they already have priority in those top JCVI lists and will be vaccinated soon, will be in the cohort that are vaccinated by the middle of February. Some will not, and therefore I do think there is absolutely a need to allow clinicians to have flexibility, and sometimes it's up to a clinician to decide whether somebody should be in that clinical extremely vulnerable group, and also to allow a degree, without working against the clinical prioritisation, to allow a degree of flexibility. And I know some of the island health boards, not in exclusively in the way that the member is raising, but more generally are being pragmatic in how they are organising vaccination clinics so that they are not making people travel more than they have to do that. And actually, if I look at some of the management information figures, our island health boards are actually doing very well in terms of moving through these groups quickly. But the points about those with particular clinical vulnerability, I think, are well made, and I hope they are being taken account of in the overall decision making.
Kenneth Gibson, to be followed by Miles Briggs.
Thank you, Presiding Officer. First Minister, two constituents have contacted me concerned advice provided by North Ayrshire Council. Both households have private tenancies ending in March and advised the local authority of this months ago, seeking social housing. In one instance, the elderly owners wish to move back into their property. The advice given, quoting the Private Housing Tenancies Scotland Act 2016, is that the tenant should refuse to move and await eventual eviction, probably post-COVID. The tenants have no wish to endure the stress of eviction, put themselves and their landlords through additional expense and have an eviction on their record should they seek a private let in future. Does the First Minister agree that this is a ham-fisted way to deal with impending homelessness and that local authorities should be more proactive in assisting tenants rather than await an eviction with all the difficulties that entails?
First Minister.
Well, I'm disappointed to hear about the anxiety that has clearly been caused to the member's constituents. It is certainly the case that all councils have a duty to assist people who are threatened with homelessness within 2 months, and to prevent homelessness wherever possible. And they also have a duty to provide temporary accommodation to all homeless households. We've taken further actions, of course, to prevent evictions during the course of the pandemic. If Kenny Gibson is able to provide further details to the Housing Minister, who's sitting not far away from him, I'm sure he will be happy to look into the matter and respond directly in more detail, and if necessary, provide further guidance to local authorities.
And Miles Briggs.
Presiding Officer, Sight Scotland have announced the proposed closure of Braeside House here in Edinburgh and Jenny's Well in Paisley. The care home currently supports 31 vulnerable blind and partially sighted residents here in the capital. There's obviously real concern amongst these residents and also their families. Can I ask the First Minister what discussions have taken place specifically with Sight Scotland about a package to save these homes? And if not, will the First Minister investigate potential support for the charity?
First Minister.
I have not personally had discussions with Sight Scotland about this, but the Health Secretary is indicating to me that she is meeting them next week to discuss this. I understand the concerns that will be caused by the situation that Miles Briggs has outlined. But what I would propose is that the Health Secretary communicates directly with them, perhaps after that meeting with Sight Scotland, to give a progress report.
Thank you very much, and apologies to the members I couldn't call, but that brings us to an end of First Minister's questions. I'm going to suspend this meeting and we'll resume at 2:30 with a statement on drugs. The meeting is suspended.
The Catalans, the Basques, the Galicians in the Basque.
An independent future for Scotland.
How quickly do you think a referendum can be arranged?
Best practice demands that it should be 6 months.
Just looking at the overall share numbers for Scotland at the moment, the SNP 46.4%.